Okay, I'm going to be performing Thomas test and the Rectus Femoris test. So I'm going to have the patient sitting on the edge of the table, and I'm, as the therapist, going to be at their side. What I'm going to have you do is I'm going to have you stand up here, and then just sit right on the edge of the table and take one leg, your unaffected leg, towards you, towards your body, flex your hip and your knee, and lean back onto the table, keeping that knee flexed and your hip flexed. And then what you're going to look at is you're going to look at the affected rectus femoris. If it is flush with the table, the rectus femoris and your hip flexors aren't going to be tight, so that would be negative. But if your leg is lifted up like so, that would be a positive test. And then when I push this leg back down, you want to make sure that lumbar spine is flat. Because if I push this down, and then the lumbar, they're going to want to do a lordotic lumbar spine if this hip flexor and rectus femoris is tight. So then, on top of that, I'm going to do the rectus femoris test. So while they're in this position, I'm going to put them back into neutral, and then I'm going to have them flex the knee. If their hip doesn't go into any more flexion, then we just ruled out the rectus femoris being tight, so that's going to be a negative. But if we flex this and the hip raises more, it's going to be the rectus femoris being tight.